My name is Anna and I'm a student nurse. I'm going to present to you a patient. Patient is 53-year-old Caucasian married male. Patient's job title is Business Development Manager. Patient was admitted for evaluation of reaction to immunosuppressant medication due to a kidney transplant that took place on December 14, 2008. Medication Prograf and Cellcept have been known to cause dramatic side effects, therefore patient is in for routine checkup. Past medical history: polycystic kidney disorder and basal cell skin cancer at age 52. All immunizations are up to date. Patient has no known medical or seasonal allergies. Hospitalization and surgeries. Patient had tonsils removed at age 4 due to excessive size and restriction of breathing. Patient had left shoulder surgery at age 19 due to a motor vehicle accident, and patient had kidney transplant 8 years ago at age 45 due to genetic disorder polycystic kidney disease. Current medications: immunosuppressant and anti-rejection medication Cellcept taken in pill form orally twice a day, once in the morning at 500 milligrams and once in the evening at 500 milligrams. Immunosuppressant anti-rejection medication Prograf taken in pill form orally twice a day, once in the morning, once in the evening, 1 milligram each time. And blood pressure medication atenolol 50 milligrams once in the morning. And cholesterol medication Simvastatin 20 milligrams once in the evening. Functional habits: health habits. Patient denies use of drugs or tobacco. Patient reports consuming alcohol roughly once every week and consuming roughly 2 drinks per time he drinks. Patient reports an exercise regimen of exercising in moderate to intense levels approximately 4 to 5 times per week. Patient gets roughly 7 to 8 hours of sleep every night. Patient consumes roughly 3 cups of coffee every day. Patient claims a healthy, nutritious filled diet with lots of fruit, protein, and vegetables. Patient reports using seatbelt in the car every time he drives or rides passengers. Psychosocial. Patient currently lives at home with his wife in Holland, Michigan. Patient has 2 children, both in college. He reports a large number of friends and family to support him and help him when he needs. Patient's father and sister are still living, and his mother is deceased. Patient denies sadness or frustration in home life. Patient reports high stress related to his job. Coping methods include spending time with family, walking his dog, watching sports. Patient practices the Christian faith. Patient graduated with a degree in business from Michigan State University in 1985. The stress of finding a kidney donor and the stress of surgery put a large toll on him and his family's mental status 8 years ago. The family has since recovered. Family history: grandmother passed away from polycystic kidney disease at age 52. Grandfather passed away of coronary disease at age 47. Mother had history of thrombosis and passed away from polycystic kidney disease at age 54. Father has history of back ailments, hypertension, poor circulation, and suffered from carotid arteries and a transient ischemic attack in 2014. Sister has high blood pressure. Aunt has severe osteoporosis and arthritis and had stage 4 melanoma with tumors spreading to kidney, lungs, uterus, and has since been cancer-free for 3 years. Patient describes himself in good health with relatively high energy. Patient reports a planned weight loss of 7 pounds that took place over 6 months. Patient reports that fever, chills, and night sweats have ceased since the physicians regulated his immunosuppressant medication. No obvious signs of renal failure are present. His temperature is 98.8 degrees Fahrenheit. Only kidney pain in area with intense exercise. No increased fluid retention, swelling in hands, feet, ankles, eyelids, or sudden weight gain. Due to the side effect and increased sensitivity to light, the chance of developing skin cancer due to the patient's immunosuppressant medication, I performed an integumentary exam. Patient denies extreme dryness of skin, as well as any rashing or itching. Patient expresses concern about skin since skin cancer he had last year. Patient also mentions that he has a spot that may be possibly of concern. When asked, patient reports spending long periods of time in the sun and his recent trip to Florida taken last week. Patient reports using SPF 30 sunscreen as well as a sun hat and sun shirt when he is outside for long periods of time. Patient denies noticing excess oil, brittleness of hair, skin, or nails. Patient reports one instance of skin cancer with his aunt. Patient's aunt is a survivor of stage 4 melanoma. Patient reports not working in the sun or with chemicals for his job. Patient denies ever obtaining blisters from a sunburn. Physical and integumentary assessment. Scalp is absence of flaking or lesion. Body hair and scalp have normal amount of hair, evenly distributed, which is normal color and texture for race. Patient is clean, absent of body odor, and normal amount of perspiration. Color, tone, and pigment of skin is normal for race. Patient has normal skin, moisture, texture, and thickness. Patient has scar on his forehead from skin cancer removal last year. Patient has abnormal brownish purple mark posteriorly on right scapular region. The mark has uneven border and is approximately 2 centimeters in diameter. Patient reports noticing this mark approximately 3 days ago, and he has noticed a change in size. He has not noticed a change in size. Patient's skin is approximate temperature with sufficient mobility turgor. When assessed for edema, patient showed no signs of pitting. Nails were clean, normal color, shape, contour, and thickness. There was no sign of clubbing, and nails were all attached. The capillary refill in the nails was less than 2 seconds. Cardiovascular. Patient denies chest pain and numbness in the jaw or arms. Patient has no history of heart disease or murmurs. Patient reports a history of hypertension due to what he believes is associated with an organ transplant. Patient denies becoming stressed from walking. Patient reports being in good health and shape for someone his age. Patient denies difficulty laying flat and typically uses a pillow. Patient denies palpitations. Patient reports having typically high cholesterol levels and would rate his stress as 7 to 10, or 7 on a scale of 1 to 10. Physical cardiovascular exam. No heaves or lifts were present in the 5 key areas of inspection. No lifts or thrills can be felt in any of the 5 areas. PMI can be felt in a rhythmic steady motion. No abnormalities such as palpitations, murmurs can be heard in any of the 5 areas: aortic, pulmonic, Erb's point, tricuspid, or mitral. S3 and S4 sounds are not present in patient. S1 AV valve closure, lub, can be heard loudest at apex and synchronous with the apical pulse. S2 semilunar valve closure, dub, can be heard loudest at the base of the heart. The immunosuppressant medication has been known to have multiple side effects. A large concern for organ donor is rejection of the new organ from the body. According to Science News, a proper method for assistance in detecting renal organ transplant failure is checking urine levels and fluid retention. I would do a genitourinary assessment to ensure that the new kidney is functioning properly and working the way it should be, and that the anti-rejection medications are working. According to Medical Education Institute, Incorporated in Life Options, another symptom for renal failure would be shortness of breath due to buildup of fluid in the body and possible anemia creating an oxygen shortage in the body. I would then perform a respiratory exam.